Imagine waking up in the emergency room and hearing this.
Good morning, Samir. My name is Dr. Palakadetti. You were admitted overnight in diabetic ketoacidosis with a blood sugar over 1,000. We've done some lab work and it looks like you have type 1 diabetes. You're going to need to check your blood sugars and give yourself insulin injections several times a day. If you don't give yourself enough, you could end up back here in the ICU. If you give yourself too much, you could die. So just be careful because your blood sugars are affected by all sorts of things like your diet, physical activity, stress, alcohol intake, infections, and many others. Any questions?
Whoa, I don't know what just happened. Do you? More than 3 million Americans with type 1 diabetes have experienced this, with more than 80 new diagnoses per day. Not only that, but type 1 diabetes carries a healthcare cost of nearly 14 times the current Powerball lottery jackpot.
Although many of these young and motivated patients are educated about their condition, it's still tough to figure out how the 70% of their lives outside of the clinic, things like their behaviors, lifestyle choices, and spending habits, affect their blood sugar readings. Many of these patients end up in the hospital several times a year due to extremely serious diabetic complications. And what they tell us is that we just wish we had a way of knowing when we were going to be in trouble so we could act before it was a problem.
So the question is, how can patients and their doctors start to learn about exactly what behaviors affect health? Here's one way. By 2020, there will be 5.2 terabytes of personally generated data on each of us. Already with your digital phenotype, Google can predict your route to work. Pandora can predict the next song you want to hear. And Facebook knows your personality better than your spouse. So why can't you use this predictive power for your health? Well, until now, this data has been locked away without being able to be collected or analyzed. It's been in the cloud. However, our partner company, Sherbit, has actually created the technology to map your digital footprint and collect all your smartphone application data to deliver it back to you so you can make sense of it instead of marketers and advertisers. And we are connecting this to health. We're taking Sherbit's technology, connecting it to electronic medical records, and crunching all these numbers down with IBM's Watson Analytics to create Sherbit Health, a powerful and predictive personal mobile health application that aggregates all of your personally generated data into one place so you can be in control of your own diabetes, not the other way around.
For example, a patient with type 1 diabetes who has downloaded the Sherbit Health app might receive a push notification saying, hey, we've noticed a dangerous trend in your blood sugars. Do you need to call for help? Do you need more information? In addition to this life-saving alert, Sherbit Health will begin to learn the user and inform them about their lives with daily insights like this. It looks like when you take more steps and have more Facebook events, your blood sugars tend to be lower. The next predictive iteration of this will actually see that you have 3 events scheduled for tomorrow and reminds you to check your blood sugars more often and be mindful of your carbohydrate intake for the day. Or that it looks like you're getting stressed out at the office. Can you use this, can you take this information and change your behaviors before you end up back in the emergency room?
By integrating hundreds of applications and data sources like wearables, social media, email, medical labs, and vitals, we can really create a predictive tool that's truly patient-focused. Patients are the most underutilized members of their own care team. That's why we want to give them the right information at the right time with the right intervention.
The business-to-business side will drive initial adoption and revenue. We will incentivize accountable care organizations by providing a shared savings model. We can also engage companies, insurance companies, large employers, device makers, and others to reach our important end user, the patient.
While we want to start with type 1 diabetes for our initial rollout to really prove out a use case, we want to demonstrate that Sherbit Health can actually access these more massive marketplaces of behavioral-driven chronic diseases, like asthma with 25 million Americans, or hypertension with over 70 million, or high cholesterol with over 100 million. With this, we can finally achieve our goal of chronic health instead of chronic disease.
We built a great team around us. Gajan is our technical advisor. He is one of the advisors for Incite, a healthcare technologist, White House technologist, and Director of Innovation R&D here at Boston Children's. Nupur is our clinical designer and a 4th-year medical student. And Mike is our type 1 diabetes patient advisor who will guide us in always making sure we're building for the patient. Sherbit is our back-end partner, and we have the CEO, Alex Senemar, here with us as well. With the $25,000 from tonight, we'll launch our initial prototype and prove out our first use case. With additional funding and initial data, we will enter into customer contracts, our first customer contracts. This revenue will drive utilization with the goal of 10,000 users by the end of 2017. Beyond that, we hope to enter into larger revenue contracts with ACOs, insurance companies, and others so that we can hopefully reach a market of 1 million users by the end of 2019.
Sherbit Health aims to empower you with novel correlations and insights to make you the expert on you. As practicing physicians, this is our mission. We envision a future where patients inform their doctors about their lives and their health, and together we work towards achieving chronic health. And this starts with Sherbit Health. Thank you.
All right, thank you. So how are you going to reach your customers? So have you started working with any healthcare organization or payer?
Yeah, so it's a great question. We've debated a lot how to drive initial adoption. We think it'll need to be through the B2B side. So for example, we've entered into discussions with the Camden Coalition ACO to see how we can use this technology to improve engagement amongst underserved primary care populations. We've also been approached by device makers that say, look, we've got these amazing technologies in this hardware now, and we can have FDA-approved blood pressure cuffs that are a watch, but patients don't really know what to do with that number. It's just a number. Sure, we know if it's low or high, but creating a companion software that can actually give context to these numbers, create a narrative and a story about your life that helps you understand what those numbers are. We think those kind of avenues will drive customer acquisition.
Your relationship with Sherbit. So I understand there are separate companies. So we can speak a little bit to that relationship today and how it might evolve over time. And then I think you did a great job expanding on your plan, given the little time you have. But if you could perhaps speak to, as a second question, the Omada Health of the world, Twine Health. I mean, on the diabetes side, we've seen a lot of great innovations, particularly in Boston. How might you work with them, or how would you set yourself apart as you raise money and try and gain patients?
So with Sherbit, we found them back in May. We had this idea, this concept of collecting this social and behavioral online data on each of us and how powerful that might be when we connect it to health. And we found this group out in California with Alex and Sherbit there. And their goal was to collect this data and bring it back to you, the user, to empower the user. And we're trying to empower the patient. So it's a good marriage there. And the relationship we have is a very mutual one. We're working towards the same goal, the same philosophy. We're pretty much partners. We have an exclusive partnership to leverage their technology and software for the use of health. And they're supporting us with a back-end platform, the software, the data collection aspect, and we are basically taking that and making a use case out of it in the healthcare system.
Go to the use case slide real quick.
Yeah.
So it's a great example. And one of the big things that we've understood going through this process is that you cannot create lasting change in a silo. That's the whole point of this, is how do we break down all these different data silos, pull it together, give it to the patient. So, for example, there's an amazing program here at Joslin Diabetes Center called the Do It program. It's an intensive program where patients come from all over the world for 4 days and spend time with endocrinologists and physicians and nurse practitioners, et cetera. And they've got some amazing results, cutting ED and utilization in half. So we want to work with companies like this, whether it's an Omada Health, whether it's a Do It program at Joslin, to provide them with another kind of software platform that can engage the patient, take the information that we all have sort of behind our firewalls as physicians, and liberate that. Give that to patients so they understand what these numbers mean, and they can make better decisions in their own lives without the need for us to have these intensive interventions with them.
So I'm really excited about the use of machine learning in healthcare to make predictions. But where do you guys stand on that spectrum? Are you in the phase of we think we could build a model here, or do you have a model that's actually making predictions at this stage?
So real quick, we're going to show sample data from IBM's Watson Analytics right here. We just put this together. We're like, let's just put in a bunch of numbers. Let's throw in some like continuous glucose numbers, Fitbit sleep time, Fitbit steps, Facebook events, really disparate data sets, just to see that if there was some sort of prediction, could something like a computer algorithm find it? And so it does show trend lines on our actual mock-up. It did show, I think if you guys remember, an 86.1% predictive measure that Facebook events and Fitbit steps correlated to your continuous blood glucose. Yes, these are all made up numbers, but this is the kind of stuff we expect to collect from a user. Everything from social media to wearables to continuous blood glucose monitors to blood pressure cuffs. And we're so excited to see what kind of correlations we find from this. Things that the healthcare world didn't even know existed yet. Thank you.